The second one is those that are on the fence. Should I continue clinical or should I leave? What would your advice be for those guys?
Again, what was your calling to do medicine? Your first question to me, I did to do medicine. Why did you do medicine? I think that's very important. That's a very important question. Today, I lecture in Taylor's University as well as an example lecturer. I speak to the final year medical students. So I asked them, there's some students who today, even in final year med school, they say, no, actually, I don't want to practice medicine anymore. You know, in final year medicine, they haven't even gone to housemanship. They're already telling me they don't want to. It's okay. It's okay, you know, because the choice of doing medicine, today a degree, a lot of people choose not to go to degrees. They think they can be an entrepreneur outside the university field. But for me, I think a degree in medicine gives you, it really pushes you. If you remember your final year medicine, I think that today is one of the toughest times of my life. I think passing that final MBBS, you know, if you just explain a question and you got to decipher and diagnose everything, there's a lot of brain power that's used. You know, your knowledge, your expertise, your experience, remembering the patient you saw, our patients, a long case, it's actually very long case in medicine. Hence, if someone can graduate from being a doctor in MBBS, that person is set apart differently, I think, right? Not to be biased towards doctors, not against anyone, but I think that ability to do a long case and come up with a clinical judgment, taking all information and coming up with a conclusion, that's an amazing skill, right? That's an amazing skill. So that skills can be used elsewhere. Do you want to do clinical medicine? As I said, I wanted to be a dermatologist, right? But life will happen along the way. You may not pass some exams. You may not get the opportunity, but nothing should stop you from going after your passion. I did not have a passion to become the chief medical officer. I did not have that ambition. I just had the passion to give my best wherever I was positioned. And along the way, I had to choose, okay, what's best for my career? I was already in admin. Now, what's best? Do I remain as a UD48, UD50 chronic MO in Putrajaya? You know, do I do that or do I use my talents and go elsewhere and on it elsewhere? So I think that decision again comes to the fact that you got to accept reality. Frustration is there. You know how to get the master's program. You may not pass your MRCP, you may not pass your exams. So what next? But do not go and do something just to achieve somebody else's dream. Do not say that person did it, so I can do it too. Not everybody is cut out to be a research and development officer in a pharmaceutical. Not everybody can go into sales. Not everybody can be an entrepreneur and start disruptive doctors. Not everyone can become a chief medical officer. It's not. It's your passion. So question yourself again, where does my passion lie? If it's clinician, then focus on being a clinician. You don't have to be a specialist to be a clinician. You can still be a consultant in many areas. You can be a psychologist, you can do so many other things. It is not all about being a specialist, right? And the third question is those who want to transition to a
join Disruptive Doctors. Oh, Disruptive Doctors. Impact.